Primary care or management of upper abdominal pain, epigastric pain mostly. So it's quite common in the OPD situation. It may be mild, moderate to severe. So depending upon the severity, you take the measures. The common causes over here are peptic ulcer disease or simple dyspepsia, gastroenteritis, acute watery diarrhea, helminthiasis, pancreatitis, and hepatitis. So peptic ulcer disease or dyspepsia is by far the commonest. To treat it is give the PPI or H2 blockers. PP dose 0.5 to 2 milligram per kg, usually 1 to 2 milligram per kg for 1 month. Give in two divided doses and give you can antacid now. And in severe cases, you can give combination PPI plus H2 blocker. In various severe disease, you give one or two shots of the injectable PPI or H2 blocker. So when the pain is over, you go for giving the antacid for 10 to 14 days or so, and PPI or H2 blocker for 1 month or so, maybe one when the crisis is over. Helminthiasis is also an important cause of abdominal pain. When the food is being taken, the helminth they go on moving a little bit of, so there can be a little bit of abdominal pain. So for pain after food and there a little bit of vomiting if the infestations are quite huge and the testing is too blurry and then all this and that, they are not needed. The clinical diagnosis, give one dose of antihelminthic, give second dose maybe 7 to 10 days after, and very severe sort of pain, even milder sort of pain, keep one more differential, acute and chronic pancreatitis. Acute by far the commonest. Here you have little bit of pain radiating to the back. Child taken the antalgic position. Back. The arching back or the arching forward. This is leaning forward. Something prayer sign like presentation, and there may be complications like shock, hypovolemia, and your hypotension, and rarely other organ involvement in the vicinity of the pancreas. In very severe disease, you can have shock, even DIC also possible. So identification of these cases, the acute watery diarrhea or gastroenteritis, you have diarrhea followed by the vomiting, and you have the epigastric pain. Subsequently, pain is turned diffuse throughout the abdomen, and child started purging, usually viral and then concomitant respiratory involvement. So treatment of those viral gastroenteritis is the ORS zinc for 14 days or so, and your and other comorbidities treatment and monitoring for signs of dehydration. If they are not over, usually it remits by 5 to 7 days or so. Rarely it goes beyond 10 days. At times it is more than 14 days. We call it persistent diarrhea or chronic diarrhea. Acute pancreatitis, if you take optimum care, it resolves by 4 to 5 days or so by supportive and symptomatic means. So diagnosis of acute pancreatitis is usually the pancreatic lipase and CT scan. So ultrasound may be an adjunct to understand the diagnosis. Treatment of severe disease needs hospitalization.